Hello, this is Oyina Ogbonna, the Director of Performance at Brownville Memorial. I have created this PowerPoint in order to address areas of concern and strategies that we have to improve health literacy among our patients in order to improve our hospital satisfaction survey. In my capacity as Director of Performance at Brownville Memorial, I have conducted and analyzed the current scenario and found two key areas of concern in need of improvement in order to bring up our hospital satisfaction survey. Area one is clear communication with patients, and area two is addressing language and cultural differences with support from translation services available through telephone. The importance of the two key areas to health literacy. Area 1, clear communication with patients. This helps the patient to better understand health information specific to them. Patients will feel more involved in their healthcare. Patients will feel more involved in their healthcare and are likely to follow the treatment plans. This also encourages patients to ask questions as they seek to improve health literacy. It also allows medical practitioners to effectively alleviate any anxiety that patients may have due to low health literacy. The importance of addressing language and cultural differences is another area of concern. Brownsville is located in an ethnically divergent metropolitan area with people of different races and foreign-born residents who speak a language other than English at home. So addressing language and cultural differences with support from translation services will impact health literacy in several ways, including plain language, promoting patient safety through clear instructions, and will also improve understanding. Translating health information into individual patient language will improve communication between patients and caregivers. Cultural sensitive health information increases patients' willingness to acquire health education on risk management and safety. Working definition of health literacy. A working definition of health literacy will include patients assessing their health needs, understanding and seeking the right health information to meet those needs. Patients will patients also have the ability to communicate clearly with providers by asking relevant questions for correct health information. Care providers will also be able to transverse any language and cultural barriers through cultural competence systems to deliver health information that improves patient safety and control of infections. Key communication principles. The National Action Plan to Improve Health Literacy is one of the instruments of national policy for improving health literacy. It was launched by the U.S. Department of Health and Human Services in 2010. Some approaches outlined in this action plan uh, available for this current health literacy workshop include the adoption of user-centered design, universal precautions application, and using the clearest form of language. The recommended best practices. Please do make small talk for preparation. Show empathy. Do consider the patient education method, be it oral or written. Ask whether the patient is satisfied or has any pending questions. Consider the autonomy of the patient. The don'ts. Please avoid using medical jargons or ambiguous words. Also avoid talking in lengthy sentences when communicating in both writing and oral language. Also, never make any assumptions, and please don't dismiss the patient's concerns regarding their own health. Overview of exercise. This is a small group exercise to help Brownville Memorial Healthcare practitioners demonstrate health communication principles or health literacy methods. The exercise will involve demonstrating how they approach patients to assess the medical problem. It will also demonstrate the use of plain language to deliver instructions. Key areas of concerns for this workshop. The goal of this exercise is to address two key areas of concerns. As stated before, this will include clear communication with patients, and secondly, the language and cultural differences barriers with support from translation services available through telephone. The materials. This small group exercise will include the use of several tools or materials, such as writing or drawing pads and pens, mock patient videos, language interpreters, recorders, and a readability test tool. The group exercise will entail a number of steps, including one, procedure. The participants will listen to patient mock videos in English or not, and also mock videos for non-English speakers, which will demonstrate proper health communication. The group will work with actual patients and families to demonstrate who have demonstrated poor health literacy. The groups will be asked to record their conversation with each patient, including an interpreter if needed. They will also assess the level of background information and test the instructions and wording used by the group using the readability test. The time frame. Group watching patient mock videos on day 1 and group interactions with actual patients on day 2, and assessing the use of proper health communication or health literacy practices will be on day 3. Expectations and outcomes. Successful use of proper health communication or health literacy will include checking the ability to use plain language using a readability test of transcribed group interactions, evaluating ability to break through language barriers by successful use of interpreters, capability to break through cultural barriers through ability to obtain adequate background information, sufficient way to deliver health information to patients through oral or written practical demonstrations. So this is the end of this presentation. Please feel free to contact me through email or by telephone if you have any questions and concerns. Thank you.